Welcome, everybody. I'm going to hand it over to our Executive Director at CEO here, Mitch Little, who will kick us off.
Thank you. Thank you, Beth. Good morning, everyone, and welcome to our Policy Roundtable examining the child tax credit and its impact on poverty. Like Beth said, I'm Mitch Little, Executive Director of the City of Philadelphia's Office of Community Empowerment and Opportunity, or better known as CEO. Our office serves as the Community Action Agency for Philadelphia. Since 1964, we were established by President Lyndon Baines Johnson as part of the War on Poverty to serve vulnerable populations. CEO's mission is to provide leadership on issues of economic justice by advancing racial equity and inclusive growth to ensure that all Philadelphians might share in the city's prosperous future. The expanded child tax credit, adopted as a part of President Biden's American Rescue Plan, is one of the most impactful anti-poverty programs in a generation or more. And in Philadelphia, it is estimated that every eligible Philadelphian that claims the child tax credit that's eligible could lift 75,000 people out of poverty. So CEO has been coordinating with the city's mayor's office to manage its outreach on CTC to ensure that all eligible Philadelphians take advantage of this benefit, especially our most vulnerable families. We also continue to advocate to make this expanded benefit permanent, which brings us to today's event. I want to take a pause and thank our sponsors today, Community Legal Services and Campaign for Working Families, both of which have worked hard to help people access this expanded tax credit and other key benefits. I want to acknowledge Debbie Friedman and Jen Burdick from CLS and Mary Arthur from the campaign. So I'll go over our agenda and a few housekeeping items. First, we'll hear research on the child tax credit from Dr. Megan Karen, one of the leading researchers on the credit's impact. We'll pause briefly for questions and then go right into a panel discussion. We will also try to answer a few questions during the panel if time permits, and then we'll close things out. Please use the Q&A feature, and we'll try to get to as many questions as we have time for. If you have a technical issue or reaction to something you hear, feel free to use the chat feature. Today's webinar is being recorded, and we'll share after the event with all those who registered. Lastly, if you're on Twitter, we encourage you to tweet using the hashtag 2022 CEO Roundtable, 2022 CEO Roundtable. With that, it's my pleasure to introduce our first speaker. Megan A. Karen is the Policy Director for the Center of Poverty and Social Policy at Columbia University. Her work explores how the tax system and social safety net can better support children and families, focusing recently on the effects of the monthly child tax credit. She's worked as a legislative aide, researcher, advocate, and university professor on child and family poverty and policy solutions in the US, UK, and Ireland. She holds a PhD from University College Dublin. Megan?
Thank you so much. Really happy to be here today. I'm going to speak for a bit, run through what some of our recent research on the child tax credit has told us about what this credit has done over the last 6 months, what it could still potentially do this coming tax time, and then look forward to having more of a discussion, can answer questions, and of course, roundtable with my fellow panelists here. So if you could advance the slide. Just a brief note, as was mentioned, I am based at the Center on Poverty and Social Policy. We're at the Columbia School of Social Work in New York City. Our sort of bread and butter is measuring poverty and also assessing the impact of social policy decisions, how they impact children and families in particular, as well as communities and our country as a whole. So we do focus a lot on federal policy work, which would be my primary focus, but we also have a partnership with New York City and focus on our local community as well. You can advance the slide. Thanks. And also just to say that no work is ever done alone. Everything is always a part of a team, and I just want to acknowledge some of my wonderful colleagues and co-authors here, which a lot of the research that I'll be talking about was done very much in partnership with them. So I'll just jump right into it. I'm sure that many of you on this webinar today are quite familiar with the recent expansions to the child tax credit, but I find it's always really nice to just sort of start off, make sure we're all on the same level, talking about the same things. So the American Rescue Plan, one of the most recent, sort of big packages of COVID relief, was passed last March, 2021. Hard to believe that's almost coming up on a year ago now. And among many other things, it delivered sort of 3 really important changes to the child tax credit for this past year. It increased the annual benefit levels. Prior to COVID, the child tax credit was available once a year as a sort of tax refund at a maximum of $2,000 per child. This increased it to a maximum of $3,000 per child, age 6 to 17, with an extra bump for young kids to a maximum of $3,600 for kids under the age of 6. It also crucially expanded eligibility to cover those with moderate, low, or no earnings in recent years who had been previously left out. And I'll talk a bit more about this in a few minutes. And it also transformed the credit from being a once a year sort of refund or reduction in your federal taxes to actually being delivered on a monthly basis in installments of up to $250 or $300 per child. Thank you. The credit was delivered on a sort of hybrid basis over this last year, just to make things a bit complicated. That was essentially because the American Rescue Plan was passed in March, and then the IRS needed a few months to get up and running to deliver these credits because it was totally new to pay this out in monthly installments. It meant that the annual amount of the credit would be paid out in 6 months worth of payments last year, which were delivered between July and December. And then the remaining 6 months will be paid out this coming tax time when families file a federal return. So basically, you may have heard in the news, you may be recipients of this credit yourself. You may have been working with families to make sure that they register to sign up and get these monthly payments. On the 15th of every month since last July, these checks were coming in, and the IRS by the end of December was essentially able to reach the overwhelming majority of children in the US. More than 61 million children were receiving these payments by December. This was reaching over 36 million households. It was a huge program, and it got off the ground with a degree of real success. Obviously, nothing is ever perfect with a brand new rollout of a policy, but it was really reaching quite a lot of children on a regular basis. This lump sum is also crucial because families will be receiving quite a lot of money, up to half of the annual credit, so up to $1,500 or $1,800 per child, when they file their federal return, which I believe tax season is open now. So in terms of outreach, I know many of you at this event today probably work directly with helping families, file their returns. This is crucial because there is still quite a lot of money on the table that families are eligible for and are due. So just to talk briefly for a minute about why these changes were so important. Prior to the recent expansion, the child tax credit did exist. It has been in place since 1997. However, it has been a smaller credit in past years, and it also was not reaching all children by any means. In fact, 1 out of every 3 children in the US were excluded from the full credit because their families earned too little to qualify. So you see in this graph on the right-hand part of your screen, what actually meant is that families needed to earn a certain level of money in order to qualify, but it also meant that families needed to earn more with each additional children to keep being eligible for the full child tax credit. This doesn't make sense in many respects. We know that wages do not necessarily rise when your family size grows. But what it meant in reality is that a family with 1 child needed to earn about $30,000 in order to qualify for the full credit. If you had 2 children, though, you needed to earn about $36,000. If you had 3 children, you had to earn over $40,000. If you had 4 children, you had to earn almost $50,000. We're getting well up into the middle class here, essentially, in terms of if we take middle class as median income in this country. And so you could be earning a decent amount of money before you're actually even able to qualify for the full credit. This left out 1 out of every 3 children in the United States on a national basis, but this did not hit kids equally. What it actually meant, again, in reality, is that 1 out of every 2 Black children were left out, 1 out of every 2 Latino children was left out. This is in contrast to about 1 out of every 4 white children being left out. About 75% of kids in single-parent families were left out. Children in larger families were left out at greater rates, et cetera, et cetera. You can advance the slide. We can see that this was hitting kids all over the country, even in states where there might have been the lowest levels of children excluded from the full credit. It was still at least 20%, 1 out of every 5 children were being left out. But of course, it was also hitting kids in much greater rates in the South, Southwest, Appalachia region. You can just click it once. You can also see then, if we look at a state by state cases, Pennsylvania, about 1/3 of all kids were being left out of the child tax credit before these expansions. But when you zero in, because of course state level information sometimes very much hides what's happening in different parts of the state. If you look within Philadelphia, these are the 3 congressional districts that cover the city. That's the level of data that we have when we get down to a more localized region. We see that actually for much of the city, about 1 out of every 2 children in Philadelphia were being left out of the child tax credit. The expansions under the American Rescue Plan included these children. So it closed that gap, and it meant that 1 out of every 2 children in Philadelphia almost were now newly included, but also, may have had to take extra steps to make sure that the IRS was recognizing that they were owed and eligible for this extra money. So again, in terms of outreach, some of this may have happened already and that families were connected to the monthly payments, but there is this really important time that we're in right now in terms of the federal tax filing season, where it's really crucial to make sure that any family with children in Philadelphia who may not have received those monthly payments gets the help that they might need to file a federal return, because they could receive the entire version of their credit, that whole $3,000 or $3,600 per child this coming tax time. You can advance. Thanks. So if you can, just hold it there for 1 second. So just to shift now to talk a little bit about what we know of the impacts of this credit. So, like I said, these expansions really closed that gap of all of those children who had been left out. We know that if all children who were eligible in the country received this credit, that on an annual basis, this could reduce child poverty in the US by about 40%. That's huge in terms of a single policy tool achieving that much child poverty reduction. My colleagues and I at Columbia have been looking at child poverty on a slightly different way over the course of the pandemic. We've been looking at child poverty rates on a monthly basis because, of course, we know that during this recent crisis, it very much matters what month you're talking about in terms of whether or not there's been a surge with the virus, whether or not employment has been higher or lower, whether or not schools have been closed or open, whether or not families are really stressed or if they're less so. And so there's a lot going on in this graph, I recognize, but just to walk you through it slightly. The black line is showing what child poverty rates could have been each month over the course of the pandemic had there been no measures of COVID relief, no stimulus checks, unemployment benefits, child tax credit. You see child poverty would have spiked at the start of 2020 when the pandemic began and would have remained quite elevated had we not taken any measures. Congress, of course, did take quite a lot of action. And so the blue line below it actually shows what child poverty has been over the course of the pandemic through the course of various policy measures. You can see I've pointed out where there are different, policy pieces have been introduced or expired. And you can see that at certain points there have been big gaps between those two lines, which is good, which means that child poverty has been really reduced. Two things I'll point out. You see that there are two sets of V's essentially around March in 2020 and 2021. That represents tax time when families might get their tax refunds and credits like the earned income tax credit, things like that. Since we're looking at monthly poverty, that means that in that month, families, had a sort of temporary windfall with these tax refunds, but it didn't last. If you look towards the end of the graph, of course, you'll see that child poverty then dipped significantly and stayed lower from about July through the end of the year. That's when the new child tax credit monthly payments came in, and were coming in every month on a regular basis and really reduced that volatility and kept families and child poverty in particular fairly low. The red dotted line is what child poverty could have looked like if we had had all the past stimulus checks and things like that, but if we had not done the child tax credit. Child poverty essentially by the end of last year would have risen up to what it could have been like, and without any sort of COVID relief in general. It could have meant that we would have lost all the progress that we made. And you can see that there's a huge gap in between those. It really means that child poverty was held at bay and reduced quite significantly just by this single type of payment. What that gap between that red line and that blue line actually translates to is millions of children around the country being lifted above the poverty line. At the time of my communications colleagues making these really beautiful graphics, we had November numbers as the latest ones. I have the December updates at the bottom there. But what it translates to is that those child tax credit payments by the end of last year were keeping nearly 4 million children out of poverty just on their own. This meant that the monthly child poverty rate was significantly lower by the end of 2021 than it was in the middle of 2021 before the payments started. And we also know that the anti-poverty effects grew over time. The IRS was able to reach about 59 million children with the very first payment back in July. This kept 3 million children out of poverty. But the IRS was able to reach over 61 million children by the end of December. This meant that the anti-poverty effects increase as coverage increases, which again means that outreach and enrollment, especially at this tax time, is really, really crucial to realizing these gains. My colleagues and I at Columbia have been obviously studying the child tax credit quite a lot over the last 6 months, but we are far from the only people looking at it. There have been researchers nationwide who essentially mobilized all of their research tools, surveys, data collection, interviews with families themselves to try and understand what has been the impact of these payments when they were in place for the last 6 months. We at Columbia published a roundup of all of this research from researchers nationwide just before Christmas. And the findings are clear. The child tax credit has been a really huge and important tool for children and families. It has reached almost all of the kids who have been eligible, but outreach is still important to make sure we cover those who may not have received it. It has buffered family incomes as this crisis continues. We know it has reduced child poverty. We know that families have actually been spending it directly on their kids and their household needs. It's reducing hunger. It was starting to make a dent on other sort of types of financial stress. We would have assumed that that would also continue if the payments had continued. There was no evidence that it was disrupting parental employment or anything that folks who are maybe less enthusiastic about the credits expansion had raised concerns over. And we also know, as I talked a bit before, that this was a really important tool for equity. I'll run through some of our key findings really quickly, and happy to take more of these questions, sort of in the discussion and the roundtable, just to show a few key, findings here. Families by and large spent the child tax credit on their family's needs. The most common item that was used that these payments were spent on was food. This was true in every single state across the country, and you can actually see that it's true up and down the income distribution. The red chart shows how families were spending the child tax credit looking at a broad swath of families below $150,000 in income. The blue chart shows what low income families, below $35,000 were spending it on. And what you can actually see is that it's the same items: food, bills, kids' clothing, housing, school or childcare. Families are the same at the end of the day. They are looking to protect their children. And when money comes in that is earmarked for kids, families are spending it on it. This evidence matches also what we know internationally from other countries that have similar things like the child tax credit in place and have had it in place for many decades. When money comes in and it is targeted towards the child, especially just in the name of the program, child tax credit, families increase their spending on child-related essentials. You can advance the slide. We've seen that, obviously poverty was going down. What this also meant on a very practical basis is that bank accounts were going up. Independent information from JP Morgan Chase showed that their checking account balances for low-income families were higher in the fall of 2021 than they were at that time even pre-pandemic. An extra $1,000 for a low or moderate income family is now, a huge cushion. It can be for emergency, unexpected expenses. It can help families get back on their feet. It can be used then to, pay down debts or other things like that. Having this extra cash on hand can be a game changer for families. We also know, as families were spending it on food, and we saw a real reduction in food insufficiency rates, which is basically just a measure of whether or not you have enough to eat in the last 7 days in your household. This dropped immediately with the introduction of the payments by about 25% among low-income families. For families without kids over the same period, it was rising. We also know, as I mentioned, that the child tax credit is really important for equity. So this is a nice chart from some colleagues at the Center on Budget and Policy Priorities. It basically shows that the yellow bars on the left is what child poverty rates looked like across groups before this temporary expansion. Increasing the credit amount, of course, was helpful. That would be those middle bars, but it's not until you actually close those gaps that was leaving out the 1/3 of all kids, but half of Black and Latino children, that you actually start to see a huge decrease in child poverty for all children. Now, the child tax credit obviously is a really important tool here, but it's not a silver bullet. It's not going to solve child poverty overnight completely. It's not going to get us down to zero. But it does make a huge gains in terms of just lowering the rates. And so that then, of course, we can try and tackle the remaining gap and make sure that all kids have a chance to succeed here. You can advance the slide. Just to say, and again, I'll just run through this briefly. I've talked a lot about the impact that it's had on reducing child poverty, but we also know that there are so many more benefits associated with it, and we could see these over the longer term. You could advance the slide. My colleagues at Columbia have done a sort of cost-benefit analysis, and basically what they find is that an investment of this sort, of course, it costs money, to have an expansion of this type of policy, but we would see actually that the program would not just pay for itself, but actually deliver positive benefits to taxpayers, recipients, and society as a whole at a value of 8 times the rate of the initial cost of the program. This means that over the longer term, children's education levels would go up, health could go up, you'd see decreased spending on sort of child welfare, criminal justice, and the health system for poor outcomes. I know we have a medical expert that will be joining us in the roundtable who can speak to this. And what this means is that, it is a cost-effective investment in the future, and it very much pays for itself in the short and long term. The last 2 things that I'll leave us with here are just a set of questions that are useful to kind of think about and reflect on, and I'm sure we'll cover some of this in the discussion about where do we go from here. We have seen over the course of COVID that policy decisions matter. We've probably seen this actually in a more extreme setting than we have in any time in recent history. It matters though, of course, though, how policy is designed. It's not enough to say, we can have an expanded child tax credit that is more widely accessible. The devil is in the details, right? Old approaches, what sometimes intentionally, sometimes unintentionally, ended up excluding so many children. And we could have, basically done a lot better in the past, but the pandemic has also shown us now what policies tools work. It matters to make access easier for families, removing burdensome paperwork, removing burdensome trips to offices in person, things like that, making it easier to access benefits, making in any sort of form, whether it's something like cash here with the child tax credit, or food or housing assistance. It makes a big difference because when families actually receive what they're eligible for, that's when you start to see the needle move on all those other important markers. Regular delivery matters, having flexibility matters, and making sure that families in whatever type of circumstance they're living in can access things really matters. And the last slide that I'll leave us with is, again, of course, we don't know what the future of the child tax credit is at the moment. It is still very much up for debate. And so that's why if you are seeing the impacts with the families that you work with directly, it's important to do two things. Of course, it's important to try and help make sure that they have filed federal returns, even if they don't normally do so for this coming tax season, so they get the rest of that benefit that they're eligible for. It's also important to weigh in with the folks who make decisions, your policymakers who represent Philadelphia and Pennsylvania as a whole, to make sure they know that this credit is important to the families that you work with, and perhaps important to yourselves if you have children and have received it. And there's two questions, what happens if we don't take action? There's a real risk that we could erase a lot of the progress that we have just made. But the counter narrative is what actually could be the future for children and families if we do continue some version of the child tax credit in the future. It is potentially a much brighter road that we could see for kids and their families if we continue to keep in place what we know now what works. So I'll leave it there, and I look forward to talking more in the discussion.
Great, thank you so much, Megan. We have two questions in the chat. The first one is, from Martush, can you just talk a little bit about the ways that the kind of opportunities to actually restore the child tax credit, such as budget reconciliation versus making it permanent? I know you're not necessarily here as a legislative strategist, but more of a researcher. But to the extent you can add to that, we'd love to hear your thoughts.
Sure. So again, some people may be familiar with this. The American Rescue Plan, of course, made a temporary expansion only for 2021. The Build Back Better legislation that the House of Representatives did pass before Christmas, and then it's still basically awaiting any Senate action, would do two things to the child tax credit moving forward. It would keep the expanded version with all those three changes, the increased benefit levels, the expanded eligibility, the monthly payments, in place for all of 2022. If the Senate happens to pass this bill soon, I'm sure that there would be something in place to get a retroactive payment for families with the January one that was missed. But Build Back Better would have also then made permanent that expanded eligibility, which basically closed that gap, which left that 1/3 of all kids left out in previous times. So that would have been a really important piece over the long term for the future. So those two things would have worked together in a really important way for families in the short and long term. We obviously don't know. It seems unlikely that the version of Build Back Better that was passed by the House is not going to be the version that the Senate necessarily takes up. We don't know what the child tax credit version would be in there in general, but we do know that if there are decisions to be made about its future, it is important to look at some of these pieces that have made the most difference to families, which again, closing that gap, making sure that the families who were newly eligible for the program continue to be so, would have some of the most important anti-poverty effects over the long term.
Great, thank you. One of the other questions in the Q&A, at tax time, are families at risk of not receiving the remainder of the credit due to taxes that they may owe?
That's a good question, actually. And I am first and foremost would say, please don't come to me with your specific tax advice. I would never want to sign off on someone's tax return. I'm not a tax attorney or an accountant. But it would be important in terms of how the child tax credit used to work, of course, was to first offset any sort of tax liability that you had. And then if the credit amount remaining was larger than what you owed, you would receive the balance of it. So it will probably very much depend on what individual circumstances would be. But of course, even just reducing your tax liability here would be important because it's money that's not going out the door. The monthly payments were an advance on your child tax credit on the sort of annual child tax credit. And so we know that those monthly payments have been really useful to families because they were able then to count on it as a regular part of their budget and budget around it. Again, like I said, every individual family is going to have different types of circumstances. Sometimes it can get quite complicated if, depending if you're filing as a single person with children or a joint filing, or if you have different custody arrangements. This is why it's really important to, if you have any questions, to try and reach out to some of your local free tax assistance preparation services. Just make sure that it's all fine. But it is important to just access trying the balance of this credit for the second half of the year at tax time this year.
Thank you. And I'm going to put in the answer to that question that families who need help with their taxes can go to our community partners, such as Campaign for Working Families, or if they're in the North Square area, SEBA, and I'll put those websites in the Q&A and in the chat. I think we're actually ready now. Those are all the questions in the Q&A. I think we're ready to transition to our roundtable discussion. So someone will bring up that slide. So I'm really, really thrilled that Laura Benshoff, reporter with WHYY's Keystone Crossroads, has joined us today. Laura, over the last few months, has probably done more reporting on the child tax credit locally here in Philly than anyone else. She's talked to parents and experts about how the CTC is affecting those families and the impact that it's having on our region. Laura's also recent stories, if you want to check out on WHYY, she's covered the efforts of Starbucks employees locally to unionize, how recent Afghan evacuees are starting new lives in Philly, and also how more women are doing gig work during COVID. So with that, I'm going to turn it over to Laura, who will lead and moderate our discussion. Thanks for joining us, Laura.
Hello, can you see me? Can you hear me? All right.
We can.
Hi, everyone. Thank you for that introduction, Beth. That's really kind. And yeah, just the unifying theme of my reporting this pandemic has been whatever the economic repercussions, whether it's covering large scale government interventions like the stimulus checks or child tax credit, and just, how people are making decisions about their finances and their work life during COVID. And so the child tax credit has been such a huge part of that. It's been such an enormous program, and I'm excited to just dig in a little bit more and talk to some of our panelists who have, represent all kind of different sides of the tax credit. So first I want to introduce Dr. George Dalembert. He wears many hats. So doctor, medical doctor, a physician at CHOP, also has a posting at the University of Pennsylvania's Medical School, works for the CHOP Policy Lab and the Leonard Davis Institute for Health Economics. And Beth and the city brought on Dr. Dalembert because he's an expert in the social determinants of health, and in particular has been doing work by putting free tax preparation clinics and financial counseling at the same site as the clinics where he would see young patients. And so this is a way of providing financial assistance or financial counseling to families at a site where they're already there to seek, regular medical care for their children. And I want to ask a little bit more about that after I introduce our other speaker, who is Dr. Nakia Owens. She is with the city, Deputy Executive Director of Family Support and Basic Needs for the City of Philadelphia's Office of Community Empowerment and Opportunity. Dr. Owens was previously at the United Way of Greater Philadelphia and Southern New Jersey, where she was responsible for leading their family empowerment and income stability initiatives. And I've actually interviewed Dr. Owens recently because she's also involved in pilots to do some guaranteed income experiments here in Philly. There's a couple of them that the city, different branches of local government have in the works this year, which is a sort of interesting offshoot of programs like the CTC and this greater interest in what does it mean to give people a guaranteed baseline of income. So I just want to start with Dr. Dallenbert and just get a little bit about what do we know. You know, when we talk about the social determinants of health, that's defined by the federal government as the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health and functioning and quality of life outcomes for people. So this is an expansive environmental view of people's health. And can you talk about what the condition of living up in poverty, growing up in poverty, does to kids health-wise?
Great question, Laura. Great to be with everybody this morning. I do find it useful, especially when something has become a bit of a buzzword, to ground our discussion in a shared understanding. So as you mentioned, it's kind of that environmental view. And I think that too often social determinants of health as a concept is framed with a solely negative connotation. But I think like you can think of it in an asset-focused way as well. It's conditions of adequate income, secure employment and good working conditions, quality education, safe neighborhoods and housing, and as well as like healthcare services and freedom from racism and other discrimination that all support health. And the medical community has really had a renewed focus on this in the last 50 plus, recently, that's a 50 plus year concept. And it's really an acknowledgement that improving health doesn't just depend on the newest medicines and the procedures, but addressing the underlying conditions of which people exist. So what does this concretely look like? I'll use an example from the innovative work of Dr. Tyra Bryant-Stevens at CHOP, who directs our community asthma prevention program. And so rather than just focusing on treating kids with asthma when they come into the hospital, the program seeks to address factors such as the quality of housing where these kids live and actually have their asthma symptoms triggered. And with support from the Hospitals Healthier Together initiative, they've actually been doing some home repairs for families of asthma patients. And in doing so, they get at that underlying cause and they prevent those downstream visits to the doctor's office, the emergency department, the intensive care unit. And so in the same breath as social determinants, you'll often hear people talking about health equity. So that's really people having the opportunity to be as healthy as possible, where nobody is limited in kind of achieving their best health because of social position or any other social determinant of health. And so by addressing social determinants of health, for those kids with asthma, for example, we're keeping them spending time with their teachers instead of their doctors, bonding with their family instead of our nurses in the hospital. They get one step closer to that optimal health.
That's a really good overview. And how have you addressed the sort of poverty piece as a form of healthcare? What have you done in your own practice to look at that, and what have you seen the results be?
So I think that one of the things that's nice about pediatricians is in my pediatric practice, I have to think about the whole family. My patient is technically the child, but I get to and must engage with the whole family. By the very nature of patients just not being able to take care of themselves, it allows me to take a step back and look at that holistic view. And so that is part of what grounds this work of anti-poverty medicine. That's focused on addressing poverty and living in the conditions of poverty as an important determinant of health. Through our medical financial partnership at CHOP, what this has meant is taking steps to get more money into people's pockets that they can use for medical, food, housing, utility expenses, or the other myriad of drivers of health that aren't really treatable right now with a prescription. This has involved partnering with multiple community organizations and really taking like an assets-based approach to this work, where we, rather than reinventing the wheel, have been able to collaborate with Campaign for Working Families and bring tax preparation into the clinical setting. We've been able to partner with Clarify and think about like how do we expand that impact and take some of those extra dollars and start to think about financial counseling and what does it look like to manage those dollars. We're expanding now into the realm of making sure that people are taking advantage of the benefits that they're eligible for. So you have a little bit more money in your pocket that you can redistribute towards other things. And all of this is aligned with our underlying mission of making sure that kids grow up and reach their maximum potential.
Do we know anything about the condition of poverty specifically, or that, living in a household that is below the poverty line, and what kinds of health outcomes that can have across someone's lifetime? What are some of the ways that can manifest in health conditions?
Yeah, so I think when it comes to poverty, the question isn't, does poverty affect kids? It's like, how doesn't poverty affect kids as they grow up? And it really has been called the greatest threat to health with very good reason. Previous research has shown that poverty is associated with worse physical health, with actual developmental problems, with mental health concerns. Additionally, it's associated with poor educational outcomes, which indirectly then ripples and affects health. Education is associated with a longer life expectancy with higher education, improved health and quality of life. So not just giving you more years, but giving you more quality years, as well as with health promoting behavior. So getting regular physical activity, not smoking, being able to go for checkups and screenings. And it really does take kind of like that systems view rather than just kind of like blaming individuals, of really understanding what are the systems and the drivers of people's behavior. And poverty is not surprisingly very closely associated with food insecurity, which means you literally can't fuel your brain to think clearly, let alone the other bodily functions necessary to maintain your physical health. And so overall, as you reduce the resources available to a child, you're compromising family relationships, you're increasing parental stress, and we know that living in stress causes physiologic changes to your body. It increases the amount of your stress hormones, and that can have long-term effects as well. So really, there's a wide range of effects of poverty, which really should motivate us to think creatively about how to address it in terms of improving health for children, as well as their families down the line.
Seems like it's an all-around stressor. Like you said, there's not a lot that it does not touch. And I want to sort of talk to Dr. Curran and Dr. Owens a little bit now just about the reception to this program. We got a great overview about how many families got this money for that 6-month period when there were, advanced monthly payments. But when there was public surveys of the program, there was a lot of, I would say the support was overall somewhat lukewarm. A lot of it depended on your partisan affiliation, whether or not you were receiving the money, your age, all these things made a difference, whether or not people were likely to support or oppose the continuation of the tax credit. And I wanted to hear from academia and I wanted to hear from government if you have any theories as to why the program was received this way and what tweaks would maybe make it be more popular. Who wants to go first? Whoever is ready.
I can speak a little bit to some of the polling because we did look at some of that in that sort of research roundup that I talked about, but it was trying to capture, all the information that's been put out there the last 6 months. And I think this is when sort of polling comes for all of us at some point, right? It's been in the news for years now about sometimes expectations are upended, with polling around the time of elections and things like that. And here's a case where actually sometimes the headlines don't necessarily match what's in the data. And so there have been, of course, some headlines from some polls and over the last couple months that suggest, as you said, a sort of, that the popularity of the program was sort of middle of the road. But actually, when you look at the details of the polling, only a small portion of those individuals who were polled were actually receiving the credit. And so the sort of, 50% of people who liked the program, liked the idea of it, is actually just, representing sort of a very wide cross section of people who have kids, don't have kids, didn't qualify for whatever reason. When you actually look inside a number of those polls, the ones who have gotten those headlines, when you look at of the people who received the credit, the support is overwhelming majority of people thought it was not just a helpful thing, but that it made a real difference in their day-to-day expenses. And you start to see actually that about 80% of people who reported receiving the credit were both a fan of it and also thought that it made an impact. That's probably about as high as you could probably hope to get in today's sort of political environment, because again, we know that, you know, sometimes just the whatever party is in power, people associate the policy with it, and you're rarely going to get to 100%. So I think it matters in terms of the families who received this money, which again was the overwhelming majority of children, over 61 million kids by December. The overwhelming majority of those families then felt that this payment made a difference. It is easy to understand why families who didn't receive it, it didn't necessarily show up on their radar. It was new, it was only in place for 6 months. And these things take time to sort of catch on in the sort of broader populace, rise up to the level of, you know, sort of piercing people's everyday thoughts if they're not direct recipients. We're also just in the middle of a pandemic that all of us really want to end and is not quite ended yet. And so, you know, it might also just reflect the fact that folks have a lot of stuff going on right now. This money was really helpful, gave some breathing room to some families, was a lifeline to other families, but families are still incredibly stressed. And so, you know, it's hard to say that one single payment was going to sort of make them feel like everything was fine when there's still quite a lot that's happening in people's lives right now.
That's helpful. Dr. Owens, did you want to weigh in as well?
Sure. I would just say that, you know, information obviously is power, right? So what Dr. Curran shared with us earlier, I think is important. I think it's important in terms of individuals being informed and, you know, basing a decision based on the information basically that's presented to them. I think from a historical standpoint, in terms of social welfare programs, that there has been an inherent distrust of, you know, giving individuals cash and, you know, cash assistance and their ability to use those funds in a responsible way. I think changing the narrative in terms of, you know, individuals who are impoverished or impacted by poverty, you know, making good, you know, having the ability or not the ability to make good decisions when all of us, whether rich or poor, make good and bad decisions when it comes to money. But there is that belief system that, you know, poor people don't make good money decisions. So, you know, a lot of our social welfare, you know, programs are built on really an inherent distrust for giving direct cash or cash assistance. And so this gives us an opportunity to really to inform and to be informative about changing the way, you know, that we do business. And I think that what Dr. Curran shared in regards to the CTC, but more importantly, the economic stimulus payments, as well as the unemployment, you know, the unemployment assistance that was given, the increased assistance that was given, the $600 to $300, and what a difference that made in people's lives. So I would just say from this seat and this standpoint, I think it's important to be informative and to inform really those individuals that may not be actually receiving those credits and know really what that, you know, and how that really makes a difference, but to inform those that may not be receiving it and really what it does, not for just those families, those children, those individuals, but really for society, I think, as a whole.
And I want to jump off of that a little bit and just talk about the way this was structured and incorporate a little bit of my reporting. So I talked to people across, you know, the income spectrum, some who were and some who were not receiving the child tax credit. And some of the things that I heard were, you know, some people who are middle class were just confused by the program. A lot of people of all income backgrounds were confused. They're like, why is this called a tax credit? What am I, you know, the IRS is a very scary agency for people to interact with. And then I also found people who just couldn't access it, because they were disconnected from the tax system. And so are there things about this, the way that this was structured that, if given another crack at this, you think the federal government should do differently or do better to increase sort of the clarity of the program and increase its impact? And anyone who wants to take this, I think, would be helpful. I don't know if Dr. Owens, if you have thoughts, or Dr. Curran.
Yeah, so I would just say that, clarity is important. And I think that's one of the things that, from our seat that we try to do, because as you mentioned, the IRS is very scary for a lot of individuals. I think particularly for individuals that don't typically file taxes, right? And getting the information out there. So I would just say that, yes, I think it's important for us to be informative, to let individuals know, but also that the fact that it comes out of the IRS's kind of department, leaves us with a greater charge in terms of moving the agenda forward and making sure that we connect even more eligible households and families to the tax credit.
Yeah, well, I mean, the pros and cons that I've heard are, well, they give people refunds every year. They have a well-oiled system. If you're well connected to it already, the money can get out the door quickly. But if you're not already integrated, people are having a lot of trouble. And even people getting the money, where some of whom I spoke to were like, I don't know if I should spend this. I'm confused about what the implications are for my tax bill. We got a question about that earlier. Did you want to add anything, either Dr. Dallenberg or Dr. Curran?
Yeah, I think, again, I think I mentioned in my remarks earlier, any sort of huge new policy program is going to have its growing pains. If we take a step back, we can see that it actually did reach a huge amount of children in a very short period of time, but it was not perfect. And I think the people who administered the program knew that right off the bat. And it was sort of, it's kind of like an overused statement sometimes, but a lot of times, people recognize that they were sort of building the plane as they were flying it, because we were trying to get, record amounts of money out the door to, yes, through an agency that, yes, does deliver refunds, but actually their primary task is to actually collect money. And so this was a sort of switch in administrative goals. And also to try and connect people with these payments who are not usually connected to the tax system, because they frankly don't owe enough in federal taxes to be required to file. And so the IRS is, can be an intimidating agency. But in terms of the context of where we were, in terms of stimulus checks had just been going out the door, about 3 rounds by it, the child tax credit was enacted as part of COVID relief, and this money was meant to get out the door quickly. The IRS, in the time that we are talking about, was actually one of the sort of best placed agencies, probably in reality, even though it was not perfect. This is where I see that, at least going through 2022, although we do think that there's a really strong case for the program to be made, longer term or permanent expansion. But we see that the IRS was getting better, even just in those 6 months that we had the chance for those monthly payments. The IRS reached 59.3 million children with the very first payment automatically. By December, they were reaching 61.2 million children. That's an addition of 2 million children over just 6 months. And a lot of that is probably down to the ground game in, cities and localities who were doing outreach and things like that. But this takes time, right? There's just logistical hurdles, trying to figure out who are the families that we need to do outreach. There are trust issues. There was the COVID pandemic where people don't necessarily want people knocking on the door and talking in person. There were a lot of challenges to overcome. And I think that, momentum was gaining. And so we are sort of, it's actually really sad to think that all of this work could, be sort of stopped in its tracks as it was just getting started. We hope that this outreach will continue for helping families file their return to try and get connected to these payments and this tax time. But we know that this is probably something that could have actually improved in a very quick amount of time had we been given more time. It's just a question of if we're given the chance to continue it.
And Laura, if I can just add one thing. So I think that one of the things, especially thinking about those who might be on the call who are, part of that ground game that is so necessary to take this from policy to something that actually is effectively affecting change for those who would most benefit from it, taking a step back and just re-examining preconceptions. So like, for example, healthcare systems don't have a role in poverty. They should stay in their lane. Like that is some of the thought of like, yeah, why don't you just treat patients and let us deal with everything else? But it's all tied together. And by taking that step back, you can really then start to innovate. And it allows you to embrace innovations. And that's more the situation we're in with the child tax credit and its expansion. We did a new thing. We supported families in addressing their basic needs. And now we should lean into it and not away from it, especially when you consider how low of a bar that statement is of addressing basic needs. And so I really do believe in that strength-based, community-engaged approach to this work. And there's so many phenomenal people in Philadelphia, in Pennsylvania more broadly, who are engaged in this work like not necessarily getting caught up in the issue of like scale and getting to hundreds of thousands of people, like that small interval gains, like every journey begins with a single step. And really thinking about like who's in the same space with you, who has similar goals, and how you can start to collaborate creatively to continue us moving this forward at that ground level, like Dr. Curran said, to reach those who would benefit from this most.
Right. When I think back to when the ACA first passed, there were so many stories about dysfunction and it not reaching people, and it takes years for a lot to stand up a large, bureaucratic operation or new benefit of some kind. I kind of want to transition a little bit into questions we're getting in, and also just looking to the future, right? Because you both have just touched on the fact that at this point, the expanded child tax credit kind of just stands out as an experiment, a one-year experiment. Build Back Better Act was not able to pass. A one-year extension of it. There's talk of trying to break apart the pieces of that social spending legislation and maybe push this through on its own in some way. But there have been counter arguments, sort of people just repeating the kind of common refrain about any welfare or benefits program is that, well, this could be discouraging people from working. So there's a push to perhaps add work requirements to a future program. And so I just want to know if anyone would like to weigh in about, if there was means testing or work requirements added, if that is what it took to get this program extended, what would be the impact on whether or not it's helping to ease child poverty, right? What are the ways and what are things that could have been done better this time, right? We have a question in the chat that says, wouldn't it be better to just have a universal child grant? I think what this person is trying to say is, do this more like some of the European countries do, where it's not a tax credit, it's just money that goes to you. So yeah, I would love to hear a little bit about, would work requirements help or hurt the program in your opinion? And also, are there other ways, if you could imagine this program being even better, how would you change it? I don't know who wants to take that. If Dr. Curran wants to add anything, Dr. Owens.
Yeah, can I just start? Yeah. I just wanted to also add and start by saying, even prior to the pandemic, over 80% of people that could work did work. Right? So you're looking over 80% of the people that could work did work. Those that didn't were you're disabled, you're elderly, and those most individuals pull themselves up out of poverty within a 5-year period. The problem comes in when a small expense, less than $400 or less than $400 throws them back into poverty, right? And so I just wanted to, state that most people that, do work, can work, do work. And that to me wouldn't be something I think that perhaps that, should be tied to it, because individuals are working 2 and 3 jobs to be able to make the family budget. So I just wanted to add a little bit of, context, but I think that, the benefits far outweigh, obviously, the consequences or the investment that's made. I think Dr. Curran shared that earlier, that it's 8 times greater in terms of what you put into the program.
Yeah, I would echo exactly what Dr. Owens was saying. First of all, it's requirements of this sort are not practical and they're not needed. Like she was saying, you basically can't have people work more than they were. The prior version of the child tax credit, as I showed, had those earnings requirements, which were in effect, essentially work requirements, but they were just tied to the level of income you were bringing in. If you were a 2-parent, 1-child family, you had needed to earn at least $30,000 prior in order to get the full child tax credit. In half of the states in this country, the minimum wage is just over $7 an hour. That's 2 parents working full-time at minimum wage. They actually still would not have qualified for the child tax credit beforehand. You can't possibly work more than that, and you still weren't qualifying. So there were huge problems when these types of barriers were in place. But we also know that it's not needed right now. We have 6 months of evidence of showing what this policy was doing in the real world. We have 2 independent studies, some from my colleagues at Columbia, others from researchers at the Washington State University and Appalachian State University, looked at the data in 2 different ways and found that there have been no changes to parental employment when these monthly payments were in place. That is the real hard data when the policy is operating in the real world. It's not having an effect. Interviews with parents are saying that it is, if anything, it's helpful. It helped them make sure that they could get to work, transportation costs. They could cover childcare when there have been disruptions to school and childcare centers. So it is a helpful supplement, but it in no way replaces work. What continues to disrupt work right now is COVID. We know from the Census Bureau that over the holiday season, end of December, early January, when Omicron was really surging in a lot of places, 9 million people who were working were not able to go to work because either they were sick or they were caring for someone in their family who was sick. So we need to address, what's really happening to disrupt work right now, which continues to be the pandemic. The child tax credit, by contrast, has actually been something that's been stepping in during this crisis and has been really helpful to families. And we see no evidence from other countries either, where something like this has been in place for decades, even not in a crisis situation, that it impacts employment in any sort of negative way. And so, these types of calls for these requirements would really only put more barriers and exclude kids from accessing the program rather than doing anything to sort of, make the program better in any sort of way.
So is it fair to say that fewer children would be raised out of poverty if these types of requirements were enacted based on?
Oh, absolutely. Basically, because we just can look at variations of what the credit used to look like. And the anti-poverty effects were much, much lower because it wasn't reaching the kids who arguably could have benefited from it the most.
And could I also add that prior to this, the Earned Income Tax Credit was actually the most effective anti-poverty fighting program in the country, meaning that it had the ability and actually was decreasing poverty by over 2.3% in every city across nationally, which means that if the CTC is permanent, it has the propensity and ability to significantly outpace what the Earned Income Tax Credit has and would have done.
Yeah, that makes sense. I mean, I think my understanding is that those work requirement comments are kind of a hangover from the last time there was welfare reform, when there was some evidence that the way that certain structures do disincentivize people from returning to work if every dollar earned is a dollar you lose in food or in rental assistance. But that in, the last 20 years, we've had an increase in deep poverty. You're talking about people who are the working poor, essentially. People who are working full time and still not able to meet these pretty basic income thresholds. So we're in a very interesting moment. I'm not seeing any more questions. In the chat, there's a comment about needing to change the narrative because raising children is work. Children need it, mothers need it, and deserve it. And I think a lot of this is right. This is a narrative. This is a story. People need to tell their stories in order to fully inform policymakers about what they need and what they're getting. I think we only have about 5 minutes left. If there's any questions coming in or any other comments any of the panelists would like to make, I would open the floor now. Not seeing anything in the chat at this exact moment.
So with that, Laura, I want to thank you for your time with us today and your moderation and your commitment to these issues. So keep it up and keep your work in our local discourse. Thank you, Dr. Karen, Dr. Dallenberg, Nakia Owens, Dr. Owens from our shop for your insight and your contribution with us today on this very important issue. Thanks again to our sponsors, CLS and Campaign for Working Families. Thank all of you who've joined us today, either on Facebook or as a part of our program today. Let us all sort of, as we think about heroes, we're some of the folks and families that we're talking about, we refer to them as heroic. We owe them a heroic response. And that is to, as society, to care for our most vulnerable, our children, and support their opportunity and their path forward to reach their potential. So thank you all, and we hope to see you soon.
Thank you.
Thank you.